doing the disappearing act, the Houdini thing.
Life as a public official. Let me go back to some of my earlier comments. They were not intended, and I don't think they came across this way, but let me clarify, to disparage USAID outreach for capacity building. But I think as you further discuss the points, your comments were very germane, Dr. Ahmed, in that this is a fledgling democracy. We work off of certain operational assumptions, premises, that there is going to be capacity to absorb this type of aid quickly. And whenever you're not dealing with well-defined institutions that aren't necessarily fully reflective of the principles of self-determination and therefore are not going to be more transparent and have power consolidated into the hands of fewer institutions, fewer people who may be in a situation to manipulate, your outcomes are going to be messy and difficult. I think the benefit, though, of this hearing is actually staring that in the face under the very real constraints, though, of the geopolitical urgency in the area and the new evolving U.S. strategy of security, capacity, and stability based upon a wedding of military operations as well as social outreach and institutional civil society building. We've had other hearings where we just directly talked about whether or not the military itself, as they had to learn quickly how to do in Iraq, is better positioned in some ways to deliver the types of social service inputs for capacity building in a very insecure situation versus a civilian component which may not have the ability to deal with the security situation adequately. So we're in a very constrained situation. I think that's the point. The institutions aren't sufficiently developed. We have a policy based upon the nature of our government where we have to do things quickly because of changing political dynamics, but the urgency of the security situation as well is compelling us to make this move as difficult as it is. Now, I understand the intention that what you're talking about to separate the outcome measures of how you might be implementing a healthcare clinic and what the outcome of that is versus did it stabilize the institutional capacities for, again, governance and security for the people over the long term. We just don't have strategic long-term thinking. Everybody recognizes that, but it's very hard to have that with the nature of our political system, with the nature of the, again, geopolitical movements in the arena, and with nuclear weapons sitting over the horizon, potentially falling into hands of people with very twisted ideologies who want to do us grave harm. That might be beyond the realm of what your expertise is, given the very good comments you had in terms of making our efforts more effective. But that's the constraints that we're operating under, and I guess your recommendations, short of, I heard what you said, separating the objectives of security and social capacity building and measuring those distinctly. I think if we had time, the investment in social justice outcomes does pay security dividends. I think it's a matter of time. The truncated allocation, though, of time compresses this into an artificial period without the capacities to absorb it quickly, without the experiential level, perhaps on our side, as you were just suggesting. The last thing we need is people holed up in an embassy who are spending a lot of money, who can't get out and do good things, or who are doing good things empowering the wrong people that are actually undermine the stability of the society over the long term. So that's a long editorial comment on just how I think complex this is, and if you want to talk about any other recommendations, given again the constraints of time and the nature of the political system there as well as ours, that we improve the chances of meeting the dual goals of social justice but also security. Yes?
Mostly my work is on security issues, so counterinsurgency, and it's very, I understand what you're saying, but when there's no data, that justifies that what we're doing has any impact, and it seems to be having a negative impact upon our strategic relationship with the country, I think that justifies calming down this faux timeline of urgency. Let me give you a really good example of what's going on in Pakistan. I don't like to call it counterinsurgency because what they're doing is not population-centric coin. It's actually low-intensity conflict, which is resulting in massive damage and huge displacements of persons. But even if they can clear an area, they've traditionally had problems with holding. And this is because, for example, they have inadequate police that are able to do this holding. And in counterinsurgency, that's exactly the agency that should be doing holding. I know that Dr. Ahmed has done a lot of work on police reform in Pakistan. We would like to bring DynCorp in there and churn out police in large numbers over a week. That's not how you make police. So if you want to do clear, hold, and build, you can't get to the build part if there's no security. The Pakistanis have not shared with us their operational plans. After they conduct an operation—
Do they have them?
They don't. For example, in SWAT, if you're going to think about build, you need to have, as a part of your planning, the civilian component, for example, the relief to the IDPs. If they had coordinated with us their operational plans, we could have helped them put into place the civilian relief. Now, the Army says that they have cleared their holding and they're waiting for the inept civilians to come in. That's their narrative. It's the inept civilians. Of course, the civilians are inept because they've been hollowed out for 10 years. But if they had actually been genuine partners with us, we could have helped them think through what would be the civilian requirement. So another concern that I have, other than this fake urgency, and I say fake urgency because we impose this upon ourselves when, in fact, I don't believe we can execute this aid program effectively in the time constraints and in the quantity with the quality and given the security environment. This just seems an impossible task. But we certainly can't do it without Pakistani partners. And when I look at different sectors, another good example that has immediate security implications is justice sector. One of the things that the Taliban do well is actually justice provision. They go around, they can resolve disputes expeditiously, not complicated things, family disputes, land disputes. There's no recidivism. Justice is really key, yet the Asian Development Bank, and I believe Dr. Wilder is more knowledgeable with this than I am, has spent millions of dollars doing justice sector reform. What they want is the computerized case management. They want the courthouses to be redone, but what they don't want is actual human capital development. So I'll make the other argument that it's not only the limitations of USAID, numbers, their security environment, but it's also the political system in which our partners are embedded. And this comes to a much larger issue, which I think Dr. Wilder knows a lot more about than I do, and that's civil service reform. So you keep rolling back the things that have to happen before we can effectively spend these sums of money effectively, and you realize there's no substitute to anything but a long-term commitment to capacity building.
Thank you.